This forum today is about how can we pivot. So we've taken different views, and not just legacy views of healthcare, of plans and providers and traditional tech. We've got consumer brands here, we've got new entrants, we've got luminaries, we've got folks from, like Jim coming from Nike, has a completely different view of what it means to digitize the experience.
Data is, in my opinion, truly the oil of the 21st century. So I think the shift that we will see is that people aren't just accumulating and collecting data as it is happening today, but there will be much more focus on, is the data structured? Do you have the information in a data set that allows us to build machine learning models that actually help the business or the patient forward?
If you are consumer-centric, you have to have an architecture that is person-centric. So it all starts with a data supply chain strategy, or aggregating structured and unstructured information in a way that can be put into engagement models that actually has the most impact and personalized care for the individual.
Personalization is the key to succeeding in serving consumers, and data is the lifeblood of personalization. So not just the data from a payer, not just the data from a health systems, but actually an ability to extract both on a discrete basis as well as a lifetime basis, all of the data that relates to an individual.
Our core business value is around data, and how do we continue to keep trust with our customers. We think of it as sort of a triangle. On the top of the triangle is quality. Second is security. We've spent a great deal of money in creating a secure database and security in exchange of data between us and our customers. And also the third one is ROI. We make sure that our data is collected and aggregated in a comprehensive manner, that when our customers receive them, they can derive ROI and value from them.
I think it's probably unlikely that we're going to wake up in a 5 or 10 year period and the end-to-end experience of how healthcare gets paid for and delivered is going to be massively different. Now that said, under the hood, each element of it, I think, is getting disrupted all the time. I think, we've seen a massive transformation in the last 10, 15 years, shifting the way we pay healthcare away from paying for individual widgets like an injection as part of a surgery and toward paying for the surgery as the actual product. And I think we're just going to see more and more of those over time. That's a relatively rapid disruption. We spent 200 years building the healthcare system we have today. For us to massively change the way we pay for it in a 10, 15 year period is a really rapid disruption.
And I think the key is what tech companies are pushing the boundaries to make old ways, old technologies obsolete. I think there's a lot of pressure from the status quo coming in from consumer brands, from everything from Lyft and Uber, helping move and transport patients to care and treatment. I think the retail settings like CVS and Target and all of the other retail vendors that are starting to push more into becoming lifestyle companies and engaging in the care delivery and the treatment and vitality services. All of those are what I would call kind of the inbound from external pressures onto the system to improve and to change in the way they interact with the consumer and with the provider, by the way. Plus the opportunity to leverage emerging technologies that allow you to work faster, innovate more quickly, and innovate less expensively, and integrate both consumer technologies and business technologies together.
From an integration perspective, there's definitely some challenge we face with this space. When we first launched this team, we actually built programs and tools specifically for this use case. So instead of actually relying on just purely a smartphone as the means to call Lyft, we built tools specifically for the healthcare world, where we built a dashboard web-based tool that allowed an individual user to call multiple rides for patients, both scheduled and on demand, directly within the tools they use. So what that means is we built tools that integrate into top EHR platforms, where through some of those EHR platforms, you can actually call and schedule a Lyft directly through the tools they use. So our view is that we can integrate directly within the software they're using, as well as building standalone tools that they can use to be able to call Lyft for their patients. The interesting piece that we're trying to prove over time is that providing better access to transportation for healthcare is going to, over time, lower health costs and improve health outcomes.
How do we learn from what Emids is doing here in Nashville great opening panel today with a number of players across the industry. We have companies like Nike who come in with this, sort of physical technology that also brings data that is both health data and non-health data together, and they have the opportunity to really rethink about how do we help consumers think about health not just when they're in the doctor's office or when they're signing up for their health plan, but how do we get them to think about it as they're, shopping for shoes, as they're, having healthy activities and wearing those products. Those are the types of discussions we're seeing here at Emids CMA Summit.
I've been coming to the Emids conference, I think, as long as it's been around. It is one of the most interesting conferences I go to any given year. A high-level, curated group of attendees that represent some of the most advanced thinking in our industry. I will tell you, it's one of the more productive conferences that I'll attend any given year, and one of the few that I do.